Gentlemen, let me ask you something honest. Have you ever been in that intimate moment with your partner, feeling incredible closeness and pleasure, but you notice she isn't quite on the same page? Maybe she enjoys the connection, but reaching that peak just doesn't happen for her. Or perhaps it happens occasionally, but it feels unpredictable, like you're guessing in the dark. You're not alone in this. Here's a statistic that stopped me cold when I first saw it in clinical literature. Research shows that while 95% of men regularly reach climax during intimacy, only about 65% of women do. And when you dig deeper, less than 30% of women climax from penetration alone. That is a staggering gap. And the reason that gap exists has nothing to do with how long you last, how strong you are, or how much you care. It comes down to biology, blood flow, and, most critically, angle. I'm Dr. Lila Romano, a board-certified urologist with over a decade of clinical experience working with men and couples on exactly these issues. And today I'm going to share the 5 best positions for female orgasm, backed by real peer-reviewed research, including a 2022 study where scientists used high-resolution 3D ultrasound imaging to literally measure blood flow through the clitoral structure in different positions. And yes, some positions increase that blood flow by up to 38%. I'll also share the 2 positions that almost never work and the physiological reasons why. Stay with me until the end because I'll also give you 3 bonus techniques you can use in any position starting tonight. Before we dive in, let me know in the comments where you're watching from today. I love seeing this community of men in their 40s, 50s, and beyond. For decades, men have been fed a lie. Movies, magazines, locker room conversations. They've all painted this picture that if a man simply performs long enough or intensely enough, his partner will be satisfied. And most men genuinely believe that. They're not selfish, they're misinformed, and that misinformation is costing couples real intimacy. Here's the biological truth that changes everything. The vast majority of a woman's pleasure centers are concentrated in the clitoris. And here's what most people don't realize, what most doctors don't explain clearly enough. The clitoris is not just that small external tip you can see. The full clitoral structure extends several inches internally with 2 legs that wrap around the vaginal canal, like a wishbone. This entire structure contains over 8,000 nerve endings. That is more than twice the number found in the entire penis. Think about that for a moment. During arousal, the clitoris fills with blood and becomes engorged, exactly like an erection. It becomes sensitive, swollen, and highly responsive. But here's the critical problem. In most standard positions, the ones most men default to, the angle of penetration completely bypasses consistent contact with this structure. Most of those 8,000 nerve endings are simply not being engaged, not because of anything you're doing wrong, but because the angle isn't right. And that's where the science comes in. In 2022, researchers used high-resolution ultrasound imaging to track blood flow through the clitoral structure during different positions. They discovered that certain positions increased blood flow by up to 38% compared to standard approaches, and that blood flow directly correlated with arousal intensity and orgasm likelihood. This isn't guesswork anymore, gentlemen. Researchers have literally mapped this out. So let's start with position number 5. Now, this may not rank at the very top for raw physical pressure and stimulation, but it's a powerhouse for a different reason. I'm talking about sitting face to face. When she straddles you face to face, you are seated on the edge of a sturdy bed or a firm chair, her knees on either side of your hips. Her upright posture creates natural pressure between your pubic bones. That alone provides moderate clitoral contact. But the deeper reason this position drives orgasm has everything to do with a hormone most people don't think about in this context: oxytocin. Eye contact, sustained skin-to-skin touch, synchronized breathing, feeling each other's heartbeat. These triggers flood both bodies with oxytocin, the bonding hormone, and oxytocin doesn't just feel good, it directly enhances arousal and lowers the psychological barrier that prevents many women from fully letting go. For a significant number of women, feeling emotionally safe and genuinely seen is not a romantic preference. It is a physiological requirement for orgasm. Here's how to do it. You sit first, legs slightly apart for stability. She straddles facing you, hands resting on your shoulders or chest. Your hands go on her hips, not to control movement, but to offer gentle support. The motion here is not bouncing. It is rocking, grinding, and circling. She controls the depth, the angle, and the pace, adjusting in real time to what feels best. Let her lead completely. One of my patients described this position as the first time intimacy felt like making love rather than having sex, and that emotional shift made all the difference for her ability to relax and release. Remember this, for many women, feeling truly seen is the gateway to physical release. Now, let's move to number 4, the sideline position, what most people call spooning. Stay with me here, because this position is dramatically underestimated, and the research explains exactly why. When both bodies are lying on their sides in parallel, something remarkable happens physiologically. The internal angle created is gentle and gliding rather than abrupt or forceful. There is no deep hip flexion required. There is no joint strain. The pelvic alignment is natural and relaxed, and a relaxed body, gentlemen, is a body that can actually build toward orgasm, because orgasm is a neurological event that requires the nervous system to be in a calm, receptive state. But here's the element that makes this position genuinely powerful for female orgasm. Your hand is completely free. Throughout the entire encounter, uninterrupted, you have full access to provide external clitoral stimulation, the stimulation that over 70% of women need to reach climax. No awkward repositioning, no losing the moment. The two requirements for female orgasm, consistent blood flow and reliable external stimulation, are both naturally satisfied in this position simultaneously and without effort. Place a small pillow or folded towel between her knees to align the hips and keep the angle consistent. Focus on short, rhythmic rocking rather than deep thrusting. Keep the base of your pelvis gently pressing forward so that contact never drops out. This position removes every obstacle between her and orgasm, one at a time. Now here's where it gets genuinely interesting, because this next position is a hidden clinical gem. It's barely discussed outside of research circles, and yet the data supporting its effect on female orgasm rates is impressive. I'm talking about the coital alignment technique, or CAT, which is a modified version of missionary that changes everything by focusing on one critical variable, continuity of stimulation. In standard missionary, contact with the clitoral area is intermittent. It comes and goes with each movement. Arousal builds and then partially resets, builds and resets, over and over. But in CAT, both partners shift their bodies slightly upward, about 2 to 3 inches, so that the base of your pelvis maintains constant sliding pressure against her clitoral area throughout. The movement shifts from in and out thrusting to a synchronized forward and back rocking, like a slow, intimate dance where both of you are moving together as one unit. A 2015 study found that women reported significantly higher arousal and orgasm rates with this technique compared to traditional thrusting, precisely because the stimulation never stops. It builds progressively rather than constantly resetting. Here's exactly how. Begin as a standard missionary, then shift your entire body upward 2 to 3 inches so your chest is closer to her face and your hips are aligned higher than usual. Now rock your body forward and backward rather than moving in and out. Your pubic bone should be pressing and sliding against her clitoral area with every movement. She tilts her pelvis upward to meet you, and together you find that rocking, grinding rhythm. I'll be honest with you, this takes a little practice. It might feel slightly unfamiliar the first time. Don't be afraid to laugh, to adjust, to communicate. But once you find that rhythm and lock into it, the stimulation becomes steady, progressive, and intensely effective. It's not about how hard or how fast. It's about keeping the signal steady. Now we're moving into the top two, and these are the positions with the strongest research backing. I'm talking about the missionary with a pillow. Here's the truth no one tells you about missionary. It is one of the most intimate, emotionally connected positions available to couples. The face-to-face closeness, the ability to kiss, to make eye contact, to whisper, all of that matters enormously for female orgasm, as we've already discussed. The problem is not the position itself. The problem is the angle, and fixing that angle requires nothing more than a pillow. This is critical, so stay with me. Placing a firm pillow under her hips tilts the pelvis upward at approximately 15 to 20 degrees. That tilt, which sounds minor, changes the physics of every single movement that follows. Ultrasound imaging studies have confirmed that this adjustment brings your pubic bone into consistent, direct contact with the clitoral area with every motion. Instead of movement creating sensation primarily along the internal canal, where most women have far fewer nerve endings, that upward tilt concentrates stimulation exactly where the density of nerve endings is highest. A study out of UCLA found that women reported approximately 30% improvement in sensation and satisfaction from this single adjustment. 30% from a pillow. It also increases blood flow to the anterior vaginal wall, where the G-spot is located, adding an entirely separate layer of stimulation at the same time. Here's exactly how to do it. Use a firm pillow, not a soft, fluffy one that will compress flat under her weight. A folded towel or a specifically designed wedge pillow works equally well. Place it under her hips and lower back, not her upper back. Her pelvis should tilt upward so her knees can fall slightly wider and more open. Then take your position above her and focus on forward pressure rather than depth. Angle your pelvis slightly downward during movement to maximize that clitoral contact. Experiment with pillow height. Some couples find that stacking two pillows works better depending on body proportions. Keep it nearby as a natural part of your routine, not a production. Over time, it becomes second nature. One pillow. 30% improvement. That is not an opinion. That is a UCLA study. And now we've arrived at the number one position that multiple peer-reviewed studies identify as the single most reliable position for female orgasm. And when you understand the physiology, it makes complete sense. I'm talking about women on top, face to face. And the reasons it ranks number one are backed by physics, anatomy, and psychology all at once. When she is on top, gravity works directly in her favor. Blood pools in the pelvic region, increasing engorgement throughout the entire clitoral structure. When she leans forward, her clitoris makes direct, sustained contact with the base of your penis or pubic bone. This creates the constant, rhythmic pressure that most women need to build toward climax. The internal clitoral structure, that wishbone we talked about at the beginning, receives pressure from above rather than horizontally, which is precisely the optimal angle for its anatomy. Think of it this way. If you're trying to ring a doorbell, you want direct pressure straight on, not a glancing blow from the side. But here's what makes this position truly exceptional. She has complete control over three critical variables simultaneously: angle, depth, and rhythm, and that matters enormously. In the 2022 ultrasound imaging study, researchers found that when women controlled their own angle, clitoral blood flow increased by an average of 38% compared to positions where the man controlled movement. Her control is not a preference, it is a physiological advantage. She doesn't have to hope you find the right spot. She can actively pursue it herself, adjusting in real time, and that ability to self-direct dramatically dissolves the performance anxiety that prevents many women from reaching orgasm. Here's exactly how. Lie flat on your back, pillow under your head for comfortable eye contact. She straddles you facing forward, knees on either side of your hips. Key detail, and this is critical, she should not sit straight up initially. Have her lean forward so her chest is closer to yours. This is the angle that creates direct clitoral contact with your pubic bone. Movement starts as rocking and grinding, not bouncing. Your hands rest on her hips for gentle support, not to control or direct. Encourage her to experiment with angles. Leaning forward versus sitting slightly upright changes where stimulation concentrates, and every woman's anatomy is positioned slightly differently. As she finds her rhythm, provide gentle upward pressure with your hips, not thrusting, just subtle synchronized support that meets her movement. If her knees tire, she can shift to feet flat on the bed in a supported squat. If she wants more leverage, hands on your chest or the headboard. If she needs more clitoral contact, a pillow under your hips creates the angle adjustment. And avoid thrusting upward forcefully. It disrupts the rhythm she has built and reduces the contact she is maintaining. Her control here is not just intimacy, it is a 38% increase in blood flow. That is science. Now, let's talk honestly about two positions that consistently rank at the bottom of female satisfaction surveys, and more importantly, why they actively work against the biology of female orgasm. I want to be clear, there are always individual exceptions, but understanding the physiology behind why these positions fail will help you recognize the signs and adjust gracefully in the moment. Okay, let's talk about the first position, the standing shower scene. I am not here to shame anyone for trying this. It looks cinematic. It feels like it should be intensely passionate. But the real-life physics of this position fail every single physiological requirement for female orgasm simultaneously. And in over a decade of patient conversations, I have genuinely never heard a woman describe the shower as the place she reliably reaches climax. Here's why. Slippery footing creates anxiety rather than arousal. And as I mentioned earlier, orgasm requires the nervous system to be in a relaxed state. Water actively washes away natural lubrication, creating friction and discomfort rather than sensation. The internal angle is nearly impossible to optimize when both partners are standing. Consistent external clitoral stimulation is structurally impossible to maintain. And the oxytocin-building eye contact, chest-to-chest closeness, and synchronized breathing that support orgasm, all of them are absent. This position fails on every level simultaneously. But here's the good news. If you love the idea of the setting, you absolutely do not have to abandon it. Simply move out of the direct stream of water. Use a stable surface, a bench, a ledge, for support, or transition to a seated variation that restores the angle, reduces anxiety, and allows external stimulation to be maintained. The setting remains intimate and exciting. Now it actually gives her body what it needs. It looks like a movie. But without adjustment, it performs like an obstacle course. Now, the worst position number 2 is hyper-acrobatic legs over ears. I'm begging you, gentlemen, hear me on this one. I understand the appeal completely. It signals passion, physical engagement, and total openness. But for a significant number of women, extreme hip flexion does not increase orgasm likelihood. It actively reduces it, and the reasons are physiological, not prudish. Here's what's actually happening in the body during this position. Extreme hip flexion creates physical discomfort and muscle tension, and a tense, uncomfortable body cannot orgasm. Orgasm requires the parasympathetic nervous system, the rest and restore state, to be dominant. This position activates the stress response instead. The internal angle often becomes too direct, too overwhelming, building discomfort rather than arousal. External clitoral stimulation is nearly impossible to maintain at this angle. And for men over 50 specifically, the physical demand of this position creates performance pressure that pulls you out of existence entirely. And presence, as we've discussed, matters deeply to her experience. If you want the openness and the deep intimacy this position promises, here is the fix. Tuck a firm pillow under her tailbone to reduce the degree of hip flexion significantly. Keep movements shorter and more deliberate. Bring your hand to the front for consistent clitoral stimulation. You preserve the closeness and the intensity, without either of you paying for it physically the next morning. Orgasm requires relaxation. This position, without modification, demands the opposite. Now I promised you 3 bonus techniques at the start of this video, and here they are. These work in any position, any night, with zero preparation required. The first bonus technique is the angle adjustment. Research shows that even a half-inch shift in hip positioning can increase clitoral contact by 20 to 30%. In any position where you are above her, engage your lower abdominals and tilt your pelvis slightly upward so your pubic bone aims higher rather than deeper. It is a subtle movement, but it changes the contact angle completely. You can also try angling very slightly left or right, because every woman's anatomy is positioned a little differently. Think of it like fine-tuning a radio station. A tiny movement in the right direction, and suddenly the signal goes from static to crystal clear. The second bonus technique is the shallow focus. I know this goes against what most men assume, but deeper is not better. The first 2 to 3 inches of the vaginal canal contain the highest concentration of nerve endings. Deep penetration moves past that concentration entirely. Instead, try shallow, focused movements that keep stimulation near the entrance and along the front wall, the area closest to the clitoral structure. The 2019 Archives of Sexual Behavior study confirmed that women reported significantly higher satisfaction with shallow, rhythmic movements compared to deep penetration. Combine this with consistent clitoral contact, and you are doubling your stimulation points simultaneously. The third bonus technique is the combination approach. Research shows that combining penetration with direct clitoral stimulation increases orgasm likelihood by up to 70%. 70%. That number should stop you in your tracks. This means her hand, your hand if the position allows, or a small external device designed specifically for couples. Now, some men feel that using a hand or a device signals that they are somehow not enough. Gentlemen, I need to say this clearly. That is ego, not physiology. Anatomy simply requires this type of stimulation for most women. It is not a shortcoming, it is teamwork. And choosing the smart, caring approach is not weakness, it is confidence. Now, none of this works without communication, and I know that for many couples, especially those who have been together for years, that conversation can feel surprisingly awkward. So let me give you a framework that makes it comfortable rather than clinical. Timing is everything. Do not bring this up during intimacy. Choose a calm, relaxed moment. After dinner, during a walk, winding down before bed. You might say something like, "I've been learning about ways we could make our time together even better. Would you be open to trying some new things together?" Frame it as exploration, not as fixing a problem. That framing changes everything about how she receives it. During intimacy, keep communication simple and encouraging. Does this feel good? More like this, or should I adjust? Show me the pace you like. Watch her body language, changes in breathing, muscle tension, the sounds she makes, the way her hips move. Her body is giving you feedback constantly. Some couples find a casual 1 to 10 scale helpful. She can say, "That's an 8," or "Try adjusting, that's more like a 6." It makes feedback feel collaborative rather than corrective. And early in the encounter, normalize the process. We're experimenting together. It might take a few tries to find what works best for us. That one sentence removes all pressure for perfection, and when pressure dissolves, pleasure follows. Now, before you try these positions, there are few important things I want to tell you. Some of these positions can be challenging if either partner has knee pain, hip flexibility limitations, or lower back issues. Please listen to your body and make adjustments. Pleasure should never come with pain, and there is always a modification available. Certain medications, particularly antidepressants and blood pressure medications, can affect arousal and orgasm for both partners. If you've been applying these techniques consistently for several months with persistent difficulty, please see a doctor to rule out underlying hormonal imbalances or pelvic floor dysfunction. And finally, emotional safety is foundational. If there is unresolved conflict, anxiety, or broken trust in the relationship, these physical techniques will not work on their own. Physical and emotional intimacy are deeply biologically interconnected. You cannot separate them. So, gentlemen, here is my challenge to you. Try just one of these adjustments this week. Pick the position that feels most natural or most intriguing and give it an honest attempt. And I want to hear from you. Which position on this list surprised you most? Which one are you most curious to try? Tell me in the comments below. I read every single one, and I genuinely love hearing how these techniques work for real people in real relationships. I'm Dr. Lila Romano, and I'll see you in the next video.